the first media consulting podcast, The Business Chronicles, where we dive deep into the stories of successful business owners. Here's your host, Didi and Nicholas. Thanks for joining today. Let's talk.
Hello, everyone. Welcome back to our podcast. I'm just so excited to bring to you Aaron Weiss, I should say Dr. Weiss. He owns Premier Concierge Pediatrics. And we really want to, thank you for that. We really want to kind of dig deep and ask him some questions and kind of get to know him and his business, his background, as well as, some of the successes and challenges that he's faced over the many years as a successful doctor. But we also want to be an inspiration to those who are looking to start a business. And, in this economy today, we just got to have some positive things go out there to the universe and just get from experts in their field, just to give us some feedback, on how they have managed to be successful. Dr. Weiss, how you doing, sir?
I'm doing great. Thank you so much for having me on again. It's a great opportunity, and I appreciate you having me.
You're very, very welcome. So let's dive in. Let's learn a little bit about your background, if you will.
Yeah, absolutely. So I'm actually a board certified pediatrician and neonatologist. I was initially a neonatologist by training. I did about 3 years from 2020 to 2023 in a local neonatal ICU here in Orlando. But last year pivoted in a different direction and started my own in-home concierge pediatrics practice. And my practice is one of the few in Orlando that provides exclusive in-home pediatrics care. And we actually utilize a membership model instead of a traditional insurance plan. And what that membership model is it gets you access to general pediatrics care and me 24/7. So for either a monthly or annual subscription, you get all of your well child visits, your sick visits in your home, and access to me whenever you need it. And I think one of the misconceptions with my model, there's actually two that I think of. The first is that it's actually not a traditional concierge practice, despite having the word in my name. It's actually a direct primary care practice. And one of the big points that I wanted to mention is that in concierge medicine, every single touch point comes at a cost. If your child has a fever or he or she gets sick and you want to get in touch with the doctor, every single one of those conversations has a fee associated with it. And with direct primary care, you either pay annually or yearly, and that covers every interaction that you're going to have with me. Another misconception with the model is that this replaces insurance. Actually, it's in addition to insurance. We believe that everybody needs insurance. If you get a bad diagnosis or you're in an accident, I would be unable to help you as an individual. But your day in, day out care is better managed by someone who knows you and knows your family dynamic. And that's really what prompted me to start this whole thing. A lot of my families utilize their insurance benefits for things like labs, medications, images, vaccines, etc. But really, we tried to carve out general pediatrics care and elevate that service for our families.
I love that. And so you've actually found a perfect niche. I mean, you help expecting moms, you help families with healthy children. When I was looking at your website, these are a lot of things that you bring to the table that a lot of parents really need, correct?
Yeah, it's funny. We've been open now for about 7 months. And if I look at my patient population, it's pretty diverse. I would say, if I'm estimating, maybe about half just appreciate the convenience. They like having peace of mind that when their kiddo gets sick in the middle of the night, they have someone that they know who knows them and is available for them. The other half, I think, see a benefit of having me as their doctor, a neonatologist and baby specialist. In that kind of cohort of families, I see a lot of new parents, busy parents who really appreciate the expertise and having me in their home. And I also have a percentage of families that have special needs children or children with chronic conditions. And for them, I serve a little bit of a different role. It's almost like a quarterback of care, where I'm a liaison between that family and the insurance company. I'm a liaison between that company and their subspecialists, helping things make sense and just making the process easier and more streamlined. It's actually funny. When you call almost any provider, there's that prompt. If you're a doctor, hit 1 or 2.
Mm-hmm.
Crazy how much faster that expedites things, because I've been on the phone as a patient instead of as a provider, and it's probably 2 or 3 times as long of a waiting period.
I think we've all been down that road too. And I like how you said you're the quarterback of care. That's pretty powerful, man. So, I like that. I
Yeah.
like that phrase. So let's talk a little bit about what inspired you to start this.
Yeah, I think I was frustrated. So I was, as I mentioned at the beginning, I was here working in the insurance-based system as a neonatologist for about 3 years. When you work in a hospital system, you're kind of tied to that insurance-based system. And what I noticed as a provider and as a patient and parent is that it felt like healthcare was prioritizing the bottom line and incentives instead of prioritizing patient care. And I was really frustrated. As a provider, I felt like I was really pulled really, really thin. And as a parent, I felt like there were a lot of inefficiencies and things that we could just do better. And I really spent a lot of time thinking about how I could provide another option for families to get competent healthcare from somebody that they know and trust. And that's what helped me start this practice. As a matter of fact, I spent about 6 months in my neighborhood just kind of hanging out with parents, with my kids, and asking them what their pain points were in the pediatric system to try to create a practice that solved those problems.
And I like that, you hung out with your customers or your potential customers, asked questions, right? And that's going to lead us into another question here in this segment. So let's talk about your success. What's the secret to success?
I think it's a lot of things. I mean, you could say that I care and I'm there for my families, but in reality, it's all those things. But it's because I have the time to be there for them and care. One of the things we tried to establish that sets us apart from the insurance-based system is really individualizing our care and giving time to each family. A couple of numbers that I try to tell prospective families about our business in general is a typical insurance-based pediatrician will see about 30 to 40 kids a day. And
Wow.
in their patient panel, they have sometimes between 1 and 2,000. What I'm trying to do with my practice is limit providers to a panel of 150 to 200 patients max and limit their daily intake to maybe 4 or 5 kids. So that way, for each family, I'm able to sit down, I'm able to be in your home, really figure out what you need to thrive, and spend the time with you and really be able to provide that care, that caring, different touch because you have the time to provide it.
And it basically goes quality over quantity,
Mm-hmm.
right?
Yep.
That's kind of like the business model that you're kind of implementing in your business, which makes a lot of sense.
Mm-hmm.
So every business, and we talk about this, every business has industry trends. Is there any trends, up and coming things that are happening in your industry?
I sound like I'm, beating a drum, but it's the frustration that I'm seeing with a lot of families similar to mine. I think a lot of people are trying to find ways to circumnavigate this insurance-based system and find better access to healthcare. One of the things I'm getting as an intro question when people call me now is, do you accept insurance? Which I find interesting because I think the status quo 10 to 20 to, years ago was that everybody.
Mhm.
But now you're seeing a lot of providers like myself kind of pivot. So what I think is going to happen is I think in addition to small business owners like myself and private providers trying to create their own, vision for care, I think a lot of these big businesses are also going to follow in suit and start creating, concierge or direct primary care wings of their conglomerate where they can then employ other doctors to do similarly what I'm doing outside of, insurance, the insurance scope.
Wow, that is very interesting. And you're actually seeing that from, being inside your industry. And so that's very good knowledge for our listeners to take away, that you're there, you're the expert, and you're seeing what's happening. So there's a lot of people out there that are wanting to be entrepreneurs or maybe start their business, or even business owners that are maybe, there, how would you say, there's a roadblock for some reason, there's maybe it's mental or can't get past that. Any advice to give inspiring entrepreneurs on, or business owners that are looking to start a business or continue to keep moving the needle forward?
I think the hardest thing to do is just take that initial first step. I had wanted to do this for a really long time, almost to the point where I was talking about it often. And I was, I think, just scared to take the first step to change. And for myself specifically, I had trained to do something which wasn't really serving me at the time and wasn't making me happy. And I needed to figure out something else. So having it's a lot of courage to take that first step, and it's really, really difficult. But I think once you're able to make that move and try to start something for yourself, it's almost like a snowball. Like it gathers momentum. You start seeing the successes of your hard work. And it's been really, really rewarding. I think I mentioned I just started like 7 or 8 months ago.
Right.
I've actually gotten to the place where I got to take a very small, modest salary. And just for me to say I have enough to be able to do that, it's just very rewarding. And I guess what I'm trying to say is don't be scared to do it. There's a lot of uncertainties. Every day there's uncertainties. But in hindsight, I would do it over and over and over again. This is probably the best decision I ever made.
Congratulations, man, on sticking through and moving forward and avoiding, addressing those challenges, but pushing forward. That is awesome. As we wrap up here, what are some of the best ways that our listeners can get a hold of you, your phone number, your website?
Absolutely. So our phone number is 407-584-7330. Again, that's 407-584-7330. And that number is actually ported to my cell phone. So for all my patients and prospective patients, I want people to understand when you text or call, I get it right away. And our website, which we're very proud of, is www.pcporlando.com. That's PCP, like primary care physician, or Premier Concierge Pediatrics.com.
Well, thank you so much, Dr. Weiss, for taking some time out of your busy schedule to kind of answer some of these important questions so we can help our listeners gain knowledge on your industry and what you do. And we look forward to hopefully having you back again in the near future.
Absolutely. Thanks, Didier. I appreciate it.
You're very welcome.
Thank you for tuning in to First Media Consulting Podcast. If you enjoyed the podcast, subscribe today. To nominate a business you would like to recommend to be on our show, go to firstmediaconsulting.com or call. Thank you for listening.